You may be seated. Good morning, everyone. I'm pleased to welcome you to the Tennessee College of Applied Technology's Surgical Technology and Practical Nursing pinning ceremony. Thank you, family and friends, for joining us on this special occasion. I'm honored to extend a heartfelt congratulations to the students. We are so proud of your accomplishments. This ceremony is about you. It's about your hard work and determination. It's about your perseverance and commitment. You are the future of healthcare, and we are excited to share in this moment with you and your loved ones. Through hours of studying, clinicals, and hands-on training, you've demonstrated an unwavering commitment to learning and mastering the skills necessary to become a competent and compassionate professional. Your pin is a symbol of your achievement and a reminder of the trust and responsibility of being a healthcare provider. You are embarking on a fulfilling career where you will make a difference in the lives of countless individuals. We are immensely proud of you and do not doubt you will excel professionally. Congratulations once again on this well-deserved honor. May your future be filled with success, fulfillment, and opportunity to impact the lives of others positively. I would also like to thank the instructors for investing their expertise and talents in training the next generation of nurses. Thank you very much. And finally, let's thank the support of your family and friends. And with that, let me introduce the Surgical Technology Program Director, Mrs. Abby Jedlicka.
The celebration today is not just a recognition of academic accomplishments. It is the acknowledgement of and dedication, sacrifice, and resilience of our students. Today we celebrate the very first cohort of our night surgical technology program at the Tennessee College of Applied Technology in Knoxville. When this program was imagined, we knew that it would take a unique type of student. It had to be someone who was determined, self-driven, and willing to face a challenge head-on. What we didn't know was just how exceptional this inaugural group would be. Our surgical technology program is already considered an accelerated high-intensity program. In just 12 months, our students learn anatomy, instrumentation, sterile technique, surgical procedures, and the critical thinking skills required to step confidently into the operating room. Completing this program requires grit, discipline, and heart. But you, our night program, you completed all of that with even fewer in-person lectures, fewer hands-on hours, and a schedule that demanded sacrifice from your careers, from your families, and from your personal lives. You balanced work, life, and a hybrid program that asked more of you than any other class before. And you did it with professionalism, perseverance, and an unwavering commitment to your goals. Today, we are not simply saying, well done. Today, we are saying that we are proud of you, deeply, genuinely proud. You have proven that the night program actually works, and not only works, but produces strong, capable, confident surgical technologists who are ready for the responsibility of patient care. You have become the model that future classes will have to follow. You have set a precedent, and you have set the standard. And as I look at you now, I can't help but think that future cohorts have really big shoes to fill. Each of you came into this program with a dream, and today you leave with a purpose. In the operating room, patients may never know your name, but their outcomes will depend on your competence, your vigilance, and your skill. Never forget the impact that you will make. Never underestimate the importance of what you do. As the director of this program, it has been a privilege to watch your growth from nervous students learning how to hold instruments to confident professionals ready to join a surgical team. You have earned this moment. You deserve every applause, every cheer, and every bit of pride felt in the room today. To our surgical technology graduates, thank you for taking a chance on this program, for trusting us, and for providing what is possible. As you receive your pins today, wear them as a reminder of your hard work, your journey, and the bright future that you're stepping into. Congratulations. You have made history here at TCAT Knoxville, and we cannot wait to see the incredible things that you will accomplish. We will now present the candidates for surgical technology. Surgical technology graduates, please rise. Tykia Griffin. Chelsea Hatmaker. Laura Mount. Bailey Smith. Dakota Thompson. I will now introduce Surgical Technology Associate Instructor, Miss Emily Fletcher. She's going to recite the Code of Ethics.
Okay. We will now recite the Code of Ethics. Surgical technology graduates, please repeat after me. To maintain the highest standards of professional conduct in patient care. To hold in confidence with respect to the patient's beliefs, all personal matters. To respect and protect the patient's legal and moral rights to quality patient care. To not knowingly cause injury or any injustice to those entrusted to our care. To work with fellow technologists and other professional health groups. To promote harmony and unity for better patient care. To always follow the principles of asepsis. To maintain a high degree of efficiency through continuing education. To maintain and practice surgical technology willingly, with pride and dignity. To report any unethical conduct or practice to the proper authority. adhere to this code of conduct at all times in relationship to all members of the healthcare team. Okay, you may now be seated. Congratulations. I am now pleased to welcome the Director of Nursing and Allied Health, Dr. Jake Terry.
Hello, everyone. So this morning I get to honor to talk about the nursing students, but I'm also very proud of the surgical technology students as well. I'm the director of both of the programs, and I'm very excited for both of these groups of people. So, good morning, everyone, graduates, families, friends, faculty, and our honored guest. It is my privilege and heartfelt joy to welcome you to this year's Nursing Penny Ceremony. Today is a celebration of the dedication, the resilience, the courage, and the compassion. It is the moment that symbolizes not only the completion of a rigorous study, but also the beginning of a calling to serve, to heal, and to advocate. To our graduates today, as you receive your nursing pin, you will join a long and proud tradition. For generations, nursing pins have symbolized knowledge, integrity, and commitment and caring for humanity. This small emblem reflects something far greater than its size. It represents every challenge you've overcome, every late night of studying, every clinical hour spent learning to comfort and care for patients, and every moment you refused to give up when you thought the work was overwhelming. Over the past year, you have learned not only procedures and skills, but the deeper truths of nursing, that healing is not always found in medicine alone. That listening can be a powerful and powerful as any intervention, and that the presence of compassionate nurse can change the courage of someone's or the course of someone's life. If you have learned that a nurse's strength is not only measured only in the knowledge, but in empathy. It shows in showing up again and again, even days when you didn't feel like you could be there. Your journey has taken place during a time in a world that is being reminded of how vital nursings are. Healthcare continues to evolve rapidly and needs our commitment to grow more complex and commitment to grow more complex leaders each year. Yet even in face of uncertainty, you demonstrated a remarkable resilience. You adapted to learning new environments, supported one another, and provided your capable of guys, I gotta take my glasses off. I can't see. I'm sorry. I got new glasses. Okay, I'm just gonna tell you, we have to talk about this. I got new glasses, and somehow the place I went before decided to set my stigmatism, my bifocals, down 10 millimeters, and now they've corrected them, and I can't see a thing, okay? So can I please just read this without glasses on, okay? Now I do a lot better, okay? So, to the families and loved ones here today, thank you for every encouraging word, every meal left waiting, every quiet moment of understanding when your graduate needed time and space to push forward. Your support helped them to this moment, and today we honor you as well. To our faculty and staff, thank you for guiding, inspiring, and mentoring these new nurses. You shared not only your expertise, but your heart. You molded their values to make them nursing extraordinary, and your influence will echo throughout the graduates forever. Graduates, as you prepare to step into your next role of licensed professionals, I ask you to carry 3 things with you. First, carry compassion. Let it guide your every interaction, whether it be with a patient, a colleague, or yourself. Second, carry curiosity. Healthcare is always changing, and the best nurses are lifelong learners. Thirdly, carry courage. You will make difficult decisions, face emotional moments, and advocate for those who cannot advocate for themselves. Trust your training, trust your insights, and trust that the world needs you every step of the way. Today is not only a culmination of your journey, it is a promise. A promise to uphold the standards of our profession, to honor dignity, and to serve with integrity. Wear your pen with pride, but also with humility. Let it remind you of where you are and where you started and the journey it took to get here. On behalf of the entire nursing team, I congratulate you. We are proud of you, inspired by you, and excited for the future that you will shape. May your careers be filled with purpose, growth, and moments that remind you of why you chose this remarkable profession. Congratulations, and welcome to our profession. Thank you guys for putting up with my glasses issue, okay? Now I would like to welcome to the stage the class representative for this year, Miss Maria Fiera.
Take my glasses off. All right, everyone. I wrote a little speech. As you know, my name is Maria. I want to say good morning. First, I want to thank our faculty, our families, and all the loved ones who are here today. Your support, your encouragement, and your patience have carried us to this moment. We truly couldn't have done it without you. Standing here today is something I never imagined I would be doing, but it is an honor to speak on behalf of my class that has shown so much strength, heart, and determination. When we started this journey, many of us walked in one day with a mix of excitement and fear. We wondered if we were smart enough, strong enough, or capable enough to make it through, and now here we are. About to be pinned, proud, and proof that we were always more capable than we gave ourselves credit for. This program was not easy, by all means. It challenged us academically, emotionally, mentally, and sometimes physically. There were long nights, early morning, endless reading, clinical days that left us drained, moments when we questioned everything, but there were also moments of laughter, teamwork, and encouragement, moments where one classmate lifted another one and reminded them, "You got this." We studied together, we stressed together, celebrated together, and through every challenge we grew, not just as future nurses, but as people. We learned how to show up even when we were tired. We learned how to care for patients on their hardest days. And we learned what it means to be part of a team, a true nursing family. Today's feeling is more than just a ceremony. It symbolizes the promise we carry, the promise to care, to advocate, to comfort, and to make a difference in every life we touch. It's a reminder that every skill we learned, every clinical hour we completed, every exam we passed and failed has prepared us for this very moment. To my classmates, sorry. I'm so very proud of you, each and every one of us. You all show grit, compassion, and resilience. No matter where your nursing journey takes you, whether it's long care hospitals, home health clinics, or continuing your education, please remember how hard you worked to get here. Remember the courage it took to start and the strength it took to finish. We are walking into this profession at a time when nurses are needed more than ever. And although the responsibility is great, so is the honor. We will hold hands, calm hearts for the voices of voiceless, and bring comfort when it most matters. That is the heart of being a nurse. As we receive our pins today, let them be a symbol of everything we have overcome and everything we are yet to become. Congratulations to the LPN class. We made it, and I can't wait to see the incredible nurses you will all become. Thank you.
And now we would like to present some awards to the nursing class, and Miss Valerie Branham will present them.
So we have 5 awards that we are going to be giving out today. The first one is called the Florence Nightingale Academic Distinction Award. Tonight we will recognize a student whose academic journey has been marked by discipline, drive, and unwavering thirst for knowledge. The Florence Nightingale Academic Distinction is an award to a scholar who has not only excelled in the classroom, but also inspired those around them to aim higher. Congratulations on setting the standards of excellence that reflects the very best nursing education, Miss Kristen Bookwalter. So our second award is the Healing's Hand Clinical Dedication Award. The heart of nursing lives in the clinical care, and this student has shown extraordinary grace, skill, and compassion in every patient interaction. The Healing Hands Clinical Dedication honors not only their technical expertise, but the healing presence they bring to those in need. This award reflects a true calling fulfilled with the kindness of incompetence. Congratulations, Miss Caroline Nagonia. This next one is called the Future of Nursing Leadership Award. Leadership is not only about titles, it's about vision, influence, and courage. The recipient of the Future of Nursing Leadership Award has shown all of these qualities and more, empowering others to take initiative and shape a better pathway forward for the nursing profession. We are proud to honor the leader of tomorrow who leads with heart today. Congratulations, Miss Maria Ferreira. Next, we have the Code of Ethics Award. In the moments where character is tested, this student stood firm. The Code of Ethics Award recognizes an individual who has consistently modeled professionalism, ethics, and honesty, even when no one was watching. Their integrity has been a light to their peers and a reminder of what nursing truly stands for. This is an award that we actually chose 2 recipients for. The first one is Thaisa Bornova. The second is Silas Clark. All right, the last award is the Director's Award, the Heart of Nursing. This final award is not given for grades or clinical hours, but for heart. The Director's Award titles The Heart of Nursing goes to a student whose compassion, resilience, and quiet strength embodies what it truly means to be a nurse. This individual has touched lives, uplifted peers, and reminded us of why we chose this path. Congratulations, Dante Mitchell. All right, now we'll have the presentations of the candidates and presentations of pins. Welcome to the microphone, Miss Nikki Landis.
I am proud to announce the class of 2025, Brooke Allen. Kristen Bookwalter. Regine Bost. Brianna Brewer. Tequila Brown. Silas Clark. DeMarcus Dixon. Quadaciana Evans. Will Nazier Evans. Maria Ferreira. Lanisa Garner. Kennedy Hestand. Miriam Kita. Tabitha Kamani. Jackson Topher Larkin. Margaret Buru. Dante Mitchell. Caroline Natongai. Jonathan Pettigrew. Hamida Saeed. Brianna Seymour. Taylor Sheldon. Prince Tarlu. Tiana Taylor. Victor Valyovsky. Lydia Wafula. Jermaja Williams. And now, Mr. David Gibson with the recitation of the Nightingale Pledge, and Mrs. Christina Lord, lighting of the lamp.
All right, students, please stand. So the lamp lighting ceremony dates back to the very beginning of nursing, and it represents the passing of knowledge from one generation to the next. All right. Students, please repeat after me for your Florence Nightingale Pledge. In the presence of God and those assembled here, I solemnly pledge myself to the practice of my profession faithfully. I will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standards of my profession. And will hold in confidence all personal matters committed to my knowledge. With loyalty, I will endeavor to aid the physicians in their work and devote myself to the welfare of those committed to my care. All right. Students, you may be seated. I now present to you Dr. Kelly Cheney, President of Knoxville TCAT.
Hello, everybody. How are you today? Students, I know that many of you have fan clubs out there because I heard the curtain rattle when your families were cheering for you. So that is awesome. You know, higher education is a family affair, and it takes an entire community to get students through a college course and onto graduation. TCAT students are no exception. Nursing is hard. Being a surgery technician is hard. Ordinary people like me can't do that. I just can't do what you do. But there are so many reasons to be thankful for our surgery technicians, our practical nurses, all of those in healthcare. It really takes a compassionate person, someone who is of special talent to do the things that you do and to care for the sick when they need you most. I want to take a minute, and many of our presenters this morning have already talked about family and what it takes to get to school and thanking you. But I gotta be honest here. I'm sitting in the back up here watching people over the audience. I see we have a wide array of people here today of all ages. So how about somebody shout out the youngest in the room? I know there's one in a stroller. And how old? The youngest in the room? 7 months? 7 months. Wow. Welcome to TCAT. Welcome to our tiniest of TCATs. We'll be recruiting you very soon. So how about, if you're not ashamed to say, how about the oldest in the room? 60 years old, 70 years old, 80 years old? 80. Where do I see 80? 82? Oh, wow. 82. Thank you for being here today. And I see you're a fan club of somebody. I just can't see your shirts. I'm not tall. Oh, right there. I know this guy. I know this guy. All right. All right. Well, as I mentioned, higher education is a family affair. And I thank you for supporting our students. I thank you for giving them the time that they needed to study, the sacrifices they made to have to be away from family and friends at events just to get the study time in. You see, students, you have a very important role. Your career is just getting started. If you think about it, think about 2025 as a year of learning. And 2026 rolls around in just a few weeks, and that is a year of earning for you. Yeah. And to celebrate healthcare and all the things that you have to do, I would love to tell you a story about my friend Chrissy. Now, I know there's at least one other person in the audience that has heard about my friend Chrissy, and maybe one other student. But my friend Chrissy has a story to tell, and I think it's very important to share that with family and friends at what it takes to support these nurses and surgery technicians. You see, my friend Chrissy, she was a single mom. My friend Chrissy had 2 little children, a 2-year-old and a 4-year-old. And my friend Chrissy has a unique story. Her 4-year-old daughter was diagnosed with type 1 diabetes at the age of 4. At that time, she's taking 7 shots a day. An insulin pump wasn't available, but it was a learning lesson for that family. You see, because Chrissy's daughter didn't just wake up one day with type 1 diabetes. It goes along with lots of symptoms and signs that sometimes you miss, perhaps, until the patient is gone into DKA, ketoacidosis, or something else in a life-threatening situation. So my friend Chrissy and her 4-year-old daughter and her 2-year-old son were dealing with an emergency situation. You see, the 4-year-old daughter was in a healthcare crisis. A 582 blood sugar, a helicopter ride to the nearest medical center, which just happened to be Cincinnati, Ohio, 3 hours away. So the pilot, the nurses, the other people that had to be on that helicopter was responsible for that 4-year-old little girl. And you see, my friend Chrissy had to drive 3 hours to get there. She was not going to make it there in time before the helicopter got there. But you see, her 4-year-old daughter was in the hands of nurses, very skilled nurses. But that day, leading up to that emergency room visit, lots of things happened in the life of my friend Chrissy and her young daughter and her 2-year-old son. You see, the family life got completely turned upside down with a medical crisis. So my friend Chrissy is present and tearful as the medics and RNs load her daughter into a helicopter in the wee hours of the morning in the winter of January 18th. So this young 4-year-old is loaded into a helicopter. My friend Chrissy, who drove a minivan because she had 2 kids in a car seat, loaded up her 2-year-old son, driving to Cincinnati, Ohio, knowing she would not get there before the helicopter arrived. Trusting the nurses that would care for her while she's on that helicopter. Trusting the nurses who would unload her little body from that helicopter and take her directly into an emergency room care. You see, my friend Chrissy learned a lot about life during that 24 hours. And she also learned a lot about healthcare that she didn't ever want to know. What she did know is that nurses are of unique quality. They're unique human beings. But surge techs, I want to talk to you for a minute as well. You're sitting over there looking at me right now like, what does surgery tech have to do with type 1 diabetes? Absolutely nothing right now in this story. But I will tell you, while my friend Chrissy was in the emergency room at Cincinnati Children's Medical Center with her 2-year-old little boy in the middle of the night in January, there was another family in the emergency room. And that family had a 6-year-old little boy, victim of a car crash, multiple broken bones, and headed for surgery. I will tell you this, surgery technicians. The surgeon came out to speak to that family. My friend Chrissy will tell you that was not the most compassionate person at the time. He had a job to do, and it was to save that child. But you see, there was a nurse who came out to speak to my friend Chrissy about her daughter and was briefing her and getting her ready to go into this room where they were caring for her daughter. And the nurse said to the parents who had a child in surgery, they were frantic. And she said, I can't answer the questions about your child, but let me get the surgery technician, the one that I know is going into surgery with your little girl. That surgery technician came out and became a human that cared for a parent sitting in a waiting room in the middle of the night, in the middle of winter, and eased the mind of that parent. So surgery technicians, you do amazing work. We don't always see it as patients, but you are the ones who keeps the calm. And people like Chrissy, I'm sure, thanks you immensely for that. But to my practical nurses, it's my friend Chrissy that learned a lot about life, but learned a lot that nursing care is second to none, and it matters just as much as the physician. It matters, and what you do matters. And to those surgery technicians over there, what you do matters to people like my friend Chrissy. So thank you, and people like you for helping her. Now, nurses, surgery technicians, you often see my friend Chrissy around campus. You often see her. Have you met her? Have you seen her around? Has anyone seen her around? No? Do you have any idea who she is? So if I told you that my friend Chrissy is actually me, would you believe that story? So what I said to you about my friend Chrissy is actually Kelly Cheney, 28 years ago. And I will never, ever forget the nursing care that my daughter received, even the care that my 2-year-old son, who was not a patient, but he was there with his single mom, because what else do you do? They cared for him too. And to the surgery technicians, don't ever, ever doubt your place in healthcare. You bring the peace every day. So congratulations to the class of 2025. I applaud you, and families, I thank you for supporting our students every single day. Your lives and your career is just getting started, so go make it happen. Chase your dreams. It starts today. Thank you.